everybody, it's Matt and welcome back to OK Aussie. It is Saturday 22nd of March, 10:38 p.m. Dyan was about to have an ice cream, but that stopped very prematurely. She started to go all very cognitive on me very quickly. I'm not sure what is going on. Now we've already had one very prolonged heart activity today. Heart rate down to 41 and sustained at very low oxygen at 90 previously. It would look like she might be going out, so I'm just going to get a pulse oximeter onto her. Hey sweetie, just stay with me. Now, we should be going to sleep at 10:38, but instead we've got this. Almost every night there's been some sort of weird activity going on. Last night we had focalized dystonia for a couple of hours on her left hand. Okay, sweetie, I'm just going to get this up and running so we can see what's actually happening for you, hey? Check with me. Sweetie. Bluetooth is on. Also coming online so that we've got that so we can read as we go. Oxygen stats are 90, heart rate is at 51. Audible alerts coming on. So we know if we blow thresholds. Dyan has already had all her appropriate nighttime medications, anti-seizure medications, the ASMs. 36.5, so there's no febrile temperature. 36.7, so oxygen levels have just dropped down to 89. Just quickly get a blood pressure, see what's going. Like I said, I was just about to give her an ice cream ready for her dessert. She was just going, hey Matt, I want an ice cream sandwich. We were just relaxing, watching some true crime TV on the YouTubes. Yeah, we've got Syncope at 10:41. Just going to take a blood pressure reading. Come on. Stick with me. Right, I need my tape. This. Blood pressure is 113/69. Pulse is 50. On this device, we've got oxygen stats at 89, which is why the alarm was going off. Away. So, now, normally people go, oh, 113/69, that's pretty good. Dyan's baseline should be 85/60. So, as you can see, we're not where we want it to be. Hello, you. 10:42. Dyan, do you remember passing out just then?
I was tired.
You were tired, that's nice. Cool, then you should go to sleep then, shall we?
Yeah.
No. You're not feeling good because unfortunately your pulse is quite low and your oxygen stats were very low just then as well. Current room temperature is 25.6 degrees. External temperature is 21 degrees. We have had quite a day. We had 2.5 hours where her blood pressure was very low. She was fully bradycardiac, like I said, with the pulse incredibly low. And oxygen is dropping out. Hello you, I'm right here. Now Dyan's pain level has been exceptional today. She's obviously still running the UTI. She has had hip pains, a lot of bowel related pains from the gastroparesis. She's had neck pain from the CCO, which is a craniocervical instability, and she's had intense migraines today. As I said earlier on, we were obviously on seizure alert, expecting sort of behaviour that may occur. The migraines are quite commonly predicted before seizure that may occur for her. Vertigo. Where did you go? You went vertigo. You fell down vertically, did you? Yeah. So Dyan's been feeling quite dizzy as well. Good girl. Your oxygen stats are at 95 at the moment. Heart rate's at 57. Do you have any chest pain at the moment, Serena?
No.
No. Do you have any headache or migraine pain at the moment?
Headache.
Headache.
A bad one.
A bad headache. Is it a headache in any particular location?
My hips as well.
Your hips are sore as well. Okay. Dyan, can you see my finger?
Yeah.
Okay. I just want you to follow my finger, please, with your eyes.
I can't do that.
Okay, just relax your hands. I need you to follow because your eyes at the moment are fixed and closed. Sweetie, follow my finger. You can see my finger. Just follow it to the side with your eyes. Okay, no orbital movement. I'm just going to shine a light on your eyes, sweetie.
No.
Okay, I'm so sorry, sweetie.
That's really annoying.
Yeah, you're getting a 1 in dilation, both pupils equal and reactive. Dyan, what's today?
It's not Friday, it's Saturday.
What day is it?
Saturday?
Saturday, absolutely. And what month are we in, Dyan? March, okay.
Are we in March?
Yes, we're March, sweetie.
March.
Okay, doing really well on that one.
I'm not stupid.
No, you're not stupid at all, sweet pea. Nothing's wrong.
Wait.
Oxygen stats are 95, heart rate is at 56 at the moment, flapping around that 55, 56 range. Hips are sore. Current time 10:48 p.m. Oxygen stats have just dropped to 93, heart rate's just popped into 49. Oxygen stats are 92. You can see the eyebrows moving with the oro blepharism at the moment, a bit of jaw movement coming through from the mandible muscles, but it's mainly the eyebrows. So this is part of the segmented cranial dystonia, parts of the face that will start to either tighten or fibrillate. Eyes are in a fixed position, which is part of the blepharism. The eyebrows are fluctuating. We've got a bit of tick movement happening with the hand, as you can see as well. No dystonia in either left and or right. No dystonia in either feet. Beautiful. How are we? Clutching of chest, 10:49, indications of chest pain. Heart rate's at 52, oxygen stats are at 92, sustained. Do you want any spray for your chest at all, sweetie? Heart rate's just dropped down to 48. Well, that's going off. Oxygen stats are still 92. Still indicating chest pain, mid-sternum. Dyan, just open up. I'm just going to give you a spray of GTN, please. Single spray, GTN, 10:49. Hey Google, set timer, 5 minutes.
Got it. 5 minutes.
5-minute countdown response now. What we're getting is the jaw thrusting on the left-hand side of the face, part of the oromandibular. So this part of the masseter muscles is engaging. This is all part of the segmented cranial dystonia. So we've actually now had the eyebrows working initially, then it's progressed into the jaw with the jaw thrust and the muscles around the masseter going up to the TMJ, transmandibular joint. So the right-hand jaw thrust. You can see the muscle and engagement in that. So this is segmented cranial dystonia, part of the dystonic action, which is involuntary muscle contractions. This is a neurological condition. This is coming out of engagement with the basal ganglia. So there's some disruptions to the motor movement signals coming from the basal ganglia in the brain. Dyan, we know, has bilateral calcification of the basal ganglia. She also has multiple movement disorders. That's internationally known as FARS, F-A-H-R-S, FARS disease, part of that condition. What you're seeing here is the dystonic action of the eyebrows and the mouth and the tongue muscles. Quite commonly would see the teeth grinding, which would be called bruxism. I'm not seeing any other sort of engagement through the full body at the moment. Doing really well, Possum. Oxygen stats are currently at 90% and sustained. So this is where I get concerned, where we start getting the drops in oxygenation, and heart rate's at 59. Just watching for aspiration as we go through, of course. Sometimes the muscles of dystonia can affect the diaphragm or the still engaging secondary. Oh my goodness. I was actually expecting full TCs, tonic seizures tonight, but it looks like we're just going to go into full dystonic storm instead. Eyebrows or activity. Non-responsive stimuli. Oxygen stats are just dropped below threshold, 89%. Heart rate's at 58%. Good girl. I love you. I'm right here with you. You've had a very hard day, hard few days. We've had a horrible week, so starting perhaps tonic-clonic seizures. We've just had a full body convulsion, 10:52. Prepping. Respiration sounds. Oxygenation 89%, heart rate's at 71%. Dystonia action in the left hand, so focalization of the dystonia. We've got a generalized tonic-clonic seizure at the moment going on. You can see the feet position as well. Hand position coming through. Feet position. Hand position. Oxygen stats at 91, heart rate's elevated at 74. Hey Google, stop. That's our 5-minute warning for GTN spray revision. Still getting thresholds on the oxygen, so keeping an eye through there. 89% at the moment. Heart rate's at 75, it's a bit more elevated because of the seizures. Good girl. Good girl. Doing really well. Oxygen's at 89% sustained, heart rate's at 72. Preparing the deletion. Tonic-clonic seizure.
Oh.
Good girl. Good girl. 10:55. Oxygen stats are at 89%. Prep for the deletion. You're doing really well, sweetie. Because of Dyan's CCI, cranial cervical instability, the impingence in the neck, I'm not keeping her in a recovery position wrong. It puts too much pressure across the neck, upper spine. So I'm just keeping an eye very closely on airway. If there's any attempt of aspiration and choking, then I'll move it and clear airway. I'm right here. You're doing so well. Oxygen stats are at 90%, heart rate's at 61%. Chest indication secondary. Come on. Oxygen stats are at 89, heart rate's at 67. Come on. Current time is 10:57. 88% oxygen. 76 heart rate. Right here, darling. We've got you, we've got eyes on you, you're safe. You've got jaw thrusting from the dystonia or the oral mandible in the mouth at the moment. Fixed sensation of the eyes locked in because of the blepharism in the upper part quadrant. So you still have this segmental cranial dystonia activity going on. Oxygen stats remain at 89, heart rate's at 70, 69, 68 and dropping. That's oxygen stats, indication of chest clutching still. Dyan, do you have chest pain, sweetie? Yes? Applying secondary GTN spray. Drop open for me. Time 10:59. Hey Google, set timer 5 minutes.
Got it. 5 minutes. And that's that.
General dystonia, we've got thrashing, which is more of the chlorea. Unusual contraction, we've got it more to a right side roll compared to her standard left. It's okay. Just maintaining safety of limbs, we don't want any dislocation. High potential risk of dislocation of both hips and or knee during these activities. So I'll probably go. Oxygen stats are at 93, heart rate's at 83. We expect an increase in heart rate with the engagement of the GTN, vascular constriction. There will also be a bit of head pain that will come with it, it will cause a bit of a headache. Both eyes are glazed, forward focus, no alteration to stimuli. Tonic-clonic seizure, 10:59. Come on. Come on. Come on. You're okay. You're doing so well. Hey, Kitty. 11. Oxygen stats are at 95, heart rate's at 86. Okay, you're going to have to work with me here, sweetie. You're not exactly in a good position for this. Okay, just wait then. You're not going to pass out on me walking to the toilet. Oh, come on, sweetie. We can't do this. Sweetie, you're going to be okay. Just lie down. I can't take you at the moment. Just applying a bluey. Okay, yeah, been very aggressive. explosive on this, that's why I'm not getting alerts. This has popped off. I need this on this. Need to see what's going on.
Lady on my tongue.
Sorry, boo boo. I'm trying my best. Coming up. Oxygen starts at 94, heart rate's at 68. Current time is 11:03. Alright, just racing you to the toilet. Scoot up a little bit for me. 1, 2, 5. That's a go. Yep, certainly can. Current time 11:13. So we've just had a massive range of oxygen dropouts during that period of time, down around the 85, and it's just been sitting there and fluctuating up as we go. Great, it's coming back up. A lot of energy in that, so large toilet break that's been initiated after the seizure activities immediately, which is incredibly huge struggle for Dyan, obviously, between not tripping and falling, being able to hold herself up and actually having to be held up, and the pain is part of that process. Hey, gorgeous.
Oh my god.
Yeah, big oh my god.
Oh my god. Uh-huh.
Borrow this hand from you, please.
I can't see properly.
Okay, Dyan's just saying that she can't see properly. Now, when we've got the blepharism, that can come in quite often, affecting eyesight, affecting her ability to hold eyelids open in a set position or closed position. Just applying blood pressure, see where things are at. Current time is 11:14. Room temperature's come down now, it's 23.7. Oxygen starts dropping down again, 89%. Heart rate's 58. Blood pressure reading at 11:15 is 101/63. Heart rate at 59. Again, remember we're trying to get it back down to the 85/60, which is her standard baseline. We use that as a measurement to understand where she should be. Oxygen stats are at 88%. I have no idea what that was, Freddie. What do you want, Sweetie? You want your blankie? Yeah, sure. Oxygen is 87%. You're passing out. You're sweating. Yeah, exactly. You weren't able to hold yourself upright, were you? Yeah. You wouldn't be able to do it yourself.
I couldn't do anything myself.
No, exactly. You need supports. In fact, this is what the OT, the occupational therapist, has said in their functional capacity assessment. At these sort of times are when you actually need 2-on-1, 2 support staff to help you through these sort of episodes, whether it's a dystonic storm, tonic-clonic seizures, a cardiac or respiratory event. It's actually important to have multiple team members as we work. Oxygen stats are flapping around at the moment, coming up to 92%. Heart rate is at 56%. and we just hit threshold alert again. Obviously triggered off 88% dropping with the oxygen. Just try and do some big deep breaths for me, sweetie. 87%. Nice big breaths for me. Come on, you can open up for me. 87%.
So tired.
No, you're so tight, sweetie. It's 11:17 p.m. It is Saturday, the 22nd of March. Hey, darling. Can you see me okay? Yeah, can you see my finger? How many fingers am I holding down? Left eye keeps rolling backwards at the moment. Not being able to respond. Alerts are going off for oxygen. That's at 88, 87, 86%. Yes, sweetie. I love you heaps. You're perfectly fine. We're going to get through this. I'm going to have to give you some emergency medications in a moment. Just want to know how your chest is feeling. Yeah. I need this to slow down. So I need to know how your chest is feeling. Whoa, it's hopped up there, keeping an eye on Mum over there on his tower. Little man Max is in his room for the night at the moment. It's 11:19 p.m. Look, we were expecting seizures, dystonic episodes yet again. This is all part of 22q 11.2 deletion syndrome for Dyan. She has been struggling today, woke up with quite an intense migraine that was exacerbated and continued through into the afternoon. Pain levels have been very high today, let alone every day since post-hospitalisation, where she spent 6 days in the neurological ward, where she had daily multi-seizure types, dystonia and the Tourette's. She had breathing saturation drops as well as heart spikes and heart rate drops. Heart rate down to 33 beats per minute, all the way up to 160 in hospital for her, just in a supine, doing nothing. Crazy, isn't it? So that's why we've got her under 22 different specialists at the hospital. 22q, for those who are new to the channel, is a chromosomal disorder. It affects every part of her body, in fact up to 180, 185 different clinical symptoms triggered in that. So it's an umbrella term, that's why all these separate diagnoses: autism, ADHD, OCD, Tourette's, different seizure types, dystonia, depressions, the scoliosis, the hypermobility with Ehlers-Danlos loss, skeletal related issues, bowel related issues with gastroparesis, autoimmune. All of these fall under the heading of 22q and are caused by that for Dyan. Post-seizure, it's quite typical for Dyan 1 to fall asleep because of the chronic fatigue part of it, and this is what she'll probably be doing right now. It's 11:19. Particularly when she's had oxygen drops, she becomes more fatigued. With her heart rate also dropping, she becomes even more fatigued and struggling. I haven't applied any additional ASMs during this, so no anti-seizure medications were provided. We wanted to wait till certain thresholds are reached before I apply additional medication. She's had all her normal night medications, which should have actually contained this. So what it's telling me with all the bowel related stuff is it didn't either penetrate, so it's not been absorbed, therefore getting up to the efficacy of the medications, or it's been depleted because it's been flushed out of her system. Either which way, we're not heading through particular levels on the medications that have been provided today. And she's had her standard sodium valproate, 200 milligrams 3 times a day. She's had clonazepam, gabapentin. She's had a lot of pain medications between tramadol and rizatriptan wafers as well. A lot of things for her to deal with multi-site pain. She is also waiting for a pain referral to a pain specialist clinic as part of the condition. Ehlers-Danlos alone as a singular condition tends to cause a huge amount of pain, particularly when you've got tics from Tourette's or dystonia type action, or even just seizures. They can cause subluxations, avulsions, tears, full dislocations of different joints. His alarm has gone off like a madman. Oxygen saturations are where we're hitting still, 88%. Heart rate's at 56%. Oh, it's not helping my legs. I'll tell you that. So we're going to keep an eye on Dyan. Now it'll be nice to think that she's just going to sleep and is going to be resting. No guarantee on that at all for me, so I'm going to be having to keep up and keep alert and obviously monitoring with the alarms. And may have to apply additional medications. Of course, if certain thresholds get reached, then she'll be called an ambulance and we'll go to hospital. We don't race to do that because simply we're so used to dealing with this on a regular, almost daily basis. Yesterday she had a lot of focal dystonia in the left hand. It was locked in this contracted position, tightened up all the muscles through to here up to the biceps brachii, and that lasted for about 2.5 hours yesterday, caused some residual pain. This morning, night before, she was having tonic-clonic seizures. This is a regular exercise. Today we've had a lot of heart rate drops, like I said, down to 40 beats per minute for hours, so very suppressed. Oxygenation levels have also been dropping. They are concerning. We're waiting for various specialists at the hospital to deal with, support and manage these conditions. I'm just keeping an eye on her as she rests, as I am on her alerts. So beyond threshold, as you can see, 88, 89, 88% on the oxygen. You can see it's dropped down, and you can see the drops that continue to keep happening on a regular basis. So these are not just a little brief drop for a second. These are sustained, continual drops in these positions and on a regular basis, becoming a norm. Heart rate's good at 59. I'm happy with the heart rate side of things. Glad it's not down to 35 or 40. So I'm very happy with where the pulse rate happens to be. We've obviously got her relaxing, the breathing, respiratory rate I'm monitoring, as I can see her chest rise and fall, and she's got good respiration levels happening, even though the oxygenation is not happening enough for me. God, it's not one thing, it's another. It really is so exhausting, I must admit. It's so tiring on her poor little body. She's trying so hard with all of this. Guys, remember, any of the information or things that you see are specific to Dyan. We're here for entertainment purposes, not to tell you how to do or diagnose you. If you need a diagnosis or support, please go and see your own primary care physician or a specialist in the area that you need to. Dyan does have an umbrella condition, a chromosomal disorder, 22q11.2 deletion syndrome. That is a microdeletion of the 22nd chromosome on the long arm, missing about 40 to 60 genes. Some of those genes are very specific to causing seizures. Seizure and seizure-like activity happens in about 65% of patients with 22q. Dystonia itself is another subcondition. You saw the segmental cranial dystonia, the blepharism in the eye, oral mandibular dystonia in the tongue, thrusting and the jaw muscles. That's part of that segmental cranial dystonia. She also had some thrashing and leg cycling. That's part of more of a generalized dystonia type activity. So she's got multiple conditions running simultaneously neurologically. All again known issues with, unfortunately, the genetic issue of 22q. 3 million DNA building blocks are missing in that condition, and of course when you're missing those, they cause what you see here today. 88% still going off. Heart rate at least is at a good level. I'm happy with that. Well, we're going to wrap up there as I continue to monitor. I'm hoping that she's going to be in quite a restive mode. I'm seeing eye movement, so I'm seeing a bit of blepharism, I think, still coming through. I don't know if we can capture that on this device. It's so hard to see at the camera exactly where you want it and need it. Even in sleep last night as she was asleep, I was noticing the blepharism and the oromandibular dystonia in the face as she was falling asleep. So these things happen while asleep or awake, particularly if they're affecting the larynx, the esophagus or the diaphragm, affecting therefore swallowing activities, breathing activities when she's got it in the back or coming around to the front of the pectoralis, affecting the cardiac. Shitty condition to have to deal with, and very painful, the contractions, unfortunately, for her. Well, let's hope that she rests and gets a bit of sleep. I'm going to keep obviously up and monitoring her as we go through these alarms until things settle down. Thanks very much for being around and following our channel. Big thumbs up of encouragement to Dyan, please. Comments, questions, ideas, suggestions, always leave them below. If you're new to the channel, welcome. Don't forget to subscribe, hit that notification bell, please share as we continue to help to educate and obviously advocate for the condition. Genetic condition 22q. It is a rare condition, one of multiple rare conditions. Multiple rare conditions that Dyan's got. Sucks, really does, when you have so many things to juggle. Have a good night, guys. See you soon. Bye.